Thank you for joining us today for AI-powered Medicare. We're going to be talking about maximizing broker and agent efficiency, talk about some tools and how we're enabling these brokers and agencies to do that. We have some great panelists today, Diane and Scott. We have Tyson joining us today as well. Here's what we're going to be covering today. We're going to start off with what we're calling the Medicare dilemma. Medicare enrollment is expected to approach 80 million by the year 2030, but we're seeing approximately 90% of these agents resign or move on from their roles within the first 12 months. We'll talk about why that is. We're going to talk about some tools at the forefront of Medicare, some use cases in Medicare, starting with how do we onboard these agents? How do we streamline the enrollment process? And then looking forward, how do we proactively engage with these clients? So I'd like to introduce today's panelists. First off, my name is Drew Monroe. I am the Director of Marketing here at Skypoint. And we have two amazing panelists today, Diane and Scott. Diane is the CEO of Health Plans in Oregon, as well as a partner in Integrity Marketing Group. Diane, would you mind introducing yourself to everybody and tell us about your journey in Medicare and where you are today?
Sure, absolutely. Thank you for having me. This is super exciting. Name is Diane Faligowski. Been in the industry, this is my 18th year in April, believe it or not. And it's been quite a journey I started doing life, supplemental, and then I got into Medicare in 2006 and in love with Medicare. I love helping people with their Medicare. And if you think about how complex, how quite of a daunting task for seniors to pick a plan out of the 40 plans that they have to pick from, I really truly enjoy it. We have an agency in Oregon, one of the best in the industry. I became an integrity partner in last year, and it's been quite an honor to do what we do to help folks navigate the confusing world of Medicare. So excited to share what my team has experienced as far as quite an improvement to our productivity and our results because of Tabor, being able to utilize this tool, and quite honored to be one of the first ones to be able to use it, utilize it, and to see the success that we have because of Tabor. So,
well, thank you, Diane. And we also have Scott Reid, who is a partner at Tabor AI, as well as a former co-founder of Alignment Healthcare. And Scott, looks like you've played a role at many other organizations. Would you mind introducing yourself and your journey through healthcare and Medicare space, and now with Tabor?
I'm really old. 13 organizations, huh? Thanks, Drew.
You need two more.
Well, I guess you could say I'm a serial entrepreneur, and I've been blessed with the ability to give back and through organizations that I've been involved with. And the majority of those, the vast majority, all of them have been in healthcare. On the avocational side, like International Medical Corps, providing triage hospitals in every part of strife in the world, whether it's a war zone or natural disaster, to Los Angeles Christian Health Center, which provides healthcare to the 50% of the homeless in the United States, which reside in Los Angeles. On the vocational side, the first half of my career, the first 20 years of my career, was in senior housing, providing a best of class, most enjoyable experience for seniors as they transition into either independent senior, assisted living, memory care, or skilled nursing. So we just tried to make that point, that chapter in seniors' lives, as joyful as it could possibly be. And then the second half of my career, the second 20 years of my career, has been in managed care. As you see there, being one of the co-founders of Alignment Healthcare. Alignment is a Medicare Advantage health plan. We started it with the intent of making it a senior at the center model, which means that everything revolved around and for the care and the well-being of that senior. And it was enveloped in a tech model, which my partner Tyson was responsible for building. And it still exists today. It's publicly traded. I still think it's the best health plan in the United States. I think that what they do is unique, and it's very, very powerful. So that's pride of authorship, I think. So, and now today, next chapter is Tabor AI. And we're going to get into why I think Tabor is such a powerful solution for the Medicare industry.
Thank you, Scott. Appreciate that. Let's talk a little bit about who we are, Skypoint. We are proud to host this discussion with Diane and Scott. Skypoint is the AI platform behind the scenes powering companies like Tabor. We focus on 4 main subsectors of healthcare, focus on the senior care. So the long-term care, value-based care, home health, and senior living aspects of those subsectors. So we have created our own large learning model, LLM, in order to provide those instant answers for our clients, for those employees at those organizations, automate tasks, empowering people to provide optimized care across the continuum of care. So essentially our tagline is to chat with your data, right? So how do we do that? We provide this platform that consolidates all of your data. So your structured data, meaning your CRM, your EHR systems, as well as your unstructured data. So your video, your audio files, your photos, bringing that into a data storage called a lakehouse in order to enable it, get it AI ready for generative AI to chat with your data. So bringing that data in, enabling you to chat with all those data sources and extend it to various use cases. So increasing your occupancy, for example, if you're a senior living operator, creating lookalike resident profiles, providing personalized care plans for your residents or your patients, depending on what your organization is, as well as operational efficiency. How do I optimize my staffing plans? Where am I spending the most time and energy? What are my costs? What are my drivers, my cost drivers? Something like family engagement, being able to draft an email based on your policies and procedures to let the family members know how you're mitigating diseases for the residents, for example. And then lastly, the regulatory compliance, keeping up with HIPAA and making sure that we're providing that information in a private and secure environment. So that's a little bit about who we are at Skypoint. Now let's jump into the meat of it. Let's talk about the dilemma today. So we're calling this the Medicare dilemma. So there's an estimated 1.2 million licensed insurance agents in the US. Now that's all agents. We're talking home, life, auto, as well as Medicare, right, Diane? Some of these agents will do both, right? But the problem is a lot of the new Medicare agents that are new to the job, 95% of them often will resign within the first 12 months because it's so difficult to actually make that commission. So Diane, my question to you is, besides the commission, what do you see as the reason why these newer agents are often resigning so quickly within the first 12 months? What are some of those driving factors?
I would say being witness thousands of agents go through this industry, I would say the main common ones that make agents quit or fail would be lack of leads. So either they're not resourceful enough, or they don't have a way to generate a lot of leads to drive their business. The second thing is probably the biggest reason is inadequate training and support. As you know, especially for new agents, there's so much data, there's so much plan information, policies, coverage that we must know to do this, right? There's so much substantial training and ongoing support that we must do to help our agents get going in this industry. And the lack of comprehensive training from the carrier side, from the agency side, or FMO side could lead to a lot of frustration. And I've seen people quit because of that. The other thing too is selling too many products at once, insurance products at once, right? It's already hard enough to know about the industry of Medicare and to add life or supplements or final expense, then that could be more daunting for someone to do. So they try to do too many things at once and cannot be master of one. And the other one is regulatory changes, right? If there's anything in this world that is constant, it's change. We all know that. Adapt to change. And it's hard to adapt to change, or it's hard for a lot of people. It's hard for them to keep up to date on what's going on, what's new in the industry. And Medicare changes every year. You know, we have to do certifications and know all the new sales and marketing guidelines that Medicare has to impose on us. And the last one I would say would be work-life balance. Starting a new business, right? It acquires so much time, so much energy, and a lot of, because it's very demanding for the amount of stuff that you must learn right away to get going in this business. People quit because it's hard to juggle between your personal life and your business life. So it's like trying to keep all the balls in the air without dropping any. So the good news is Tabor AI, I believe, can solve all of these main reasons why agents quit in this industry.
Well, you set that up really nicely. So now we understand the dilemma. This is hard. This is a hard challenge that we're solving. So Scott, let's talk about Tabor. Would you mind introducing the work that you're doing at Tabor? Tell us a little bit about
Sure.
the problem that you're solving with Tabor.
Absolutely. Let's start with some gray tsunami fun facts. How about that? Today, 12,000 Americans turn age 65 every day in the United States. That equates to about 4 million a year turning age 65. So that's not open enrollment. That's just year-long turning 65. Today, there are 62 million Medicare enrollees. And as you see here, by 2030, we're going to have 80 million. As you said earlier, there are 1.2 million licensed agents in the United States, of which only about 100,000 sell Medicare.
Mm-hmm.
And about 100,000 only, as I've been quoted this by other brokers, it's about 30% of those actually write policies. So it's extremely limited. And the question is, for such a robust opportunity, and now we have to say, so when an agent writes an enrollment, they're getting paid $600 the first year and $300 every year after that, as long as that enrollee remains in their book of business. So if it's that robust and that lucrative of an opportunity for the agents out there, why aren't there more of them doing it? And why do 95% of them resign within the first 12 months? I think we're going to dig into that later, so I'll leave that alone. But so enter Tabor. While at alignment, we saw this happening before our eyes, and we couldn't understand what the heck is going on. And the reason is just what Diane said. It's just too hard to get started. And my daughter actually sold Medicare for a couple of years, and it was really, really difficult for her to create the leads. She ran commercials on public television. She did all kinds of very, very unique and creative things to try to build that book of business. It's just hard. It's hard if you're not motivated to get out there and do it. Enter Tabor. And what we decided at Tabor was there's got to be, through technology, through data, and now through AI, an ability to make that simpler for the agent. That not only benefits the agent, but it also benefits the senior themselves. Because as the agent determines what the senior's needs are, then it's up to them to go back and try to determine what the best plan is for that individual. What Tabor does, and that usually takes about 6 hours to do. What Tabor does is, in a period of about 10 seconds, it does all that 6 hours worth of work, and it's able to digest and then recommend, as we'll see later, what plans are best and what the best suggestion is for that individual based on their needs. Our vision is to be really, our vision and mission is to become the tool for all Medicare agents to use while trying to place their clients in the best possible scenario for their insurance needs. Drew, back to you.
Thank you for that introduction, Scott. Now, you did talk about a little bit of the how. Can you walk us through a little bit more specifically at a high level? How is Tabor providing all of that information for the agents and the brokers? How does this work?
Yeah, absolutely. So, everybody today in the marketplace, you hear a lot of people saying it's an AI solution. You have AI in McDonald's. I mean, it's everywhere. But what AI is not AI. It depends on the definition of AI. What we are is a chat GPT large language model that is vertically designed, which means we go deep, we educate, and we have educated, and we continue to educate the model on Medicare and Medicare policies nationwide. The way Medicare works is CMS divides the country up into counties. So each county, each payer, each health plan has a different plan for each county in the United States. So you can imagine the volumes of documentation that takes to track all that through CMS. Have taken and are taking all that documentation and ingesting it into the large language model. So that large language model then is trained and is industry and silo specific into what the health plans are in each county in the United States. We then are able to, if prompt the right questions, the agent is able to ask it specific questions, and it will respond with a very detailed answer based on that training. It will summarize, it will do comparisons, it will do coverage changes, it will do provider portal, it will do pharma. It does everything that is out there in the public domain. It has been educated with. It's very precise, it's very accurate, and it's very fast in what it does.
So what we're seeing here, correct me if I'm wrong, is an example of taking two plans, in this case, a plan Humana Choice, comparing it to a Providence plan. So an agent is going to be able to type in a question and ask, hey, can you compare this plan to this plan? And Tabor will list all of that out. Is that what we're seeing here, Scott?
That's it. Yeah, that's exactly what you're seeing. And, for an agent to do this on their own after they're trained, and that's a big statement, is being able to compare not just the two, but all plans in that particular marketplace to decide which one is best for that particular individual. And individuals have different sensitivity points. I mean, are they concerned about a deductible? Are they concerned about a maximum out of pocket? Are they concerned about a premium? What about the supplemental benefits? What about transportation, give back cards, food? I mean, all those things that go into what is important to that individual, and what is their disease state. Most seniors are chronically diseased with multiple chronic diseases, and so what is the best plan the best health plan to be able to meet the needs of that chronic disease, the medications they're taking for that disease, and the physicians that are covered in network or out of network that are able to they're able to see for that disease. So there's a whole bunch of different variables that go into making that final decision. So you can see here, you've got skilled nursing facilities, durable medical equipment. We didn't even talk about if a person has diabetes supplies. I mean, what's covered, what's not covered, how much is it going to cost me if it is covered. And then primary doctor visits. I mean, what's it going to cost to go to a primary doctor? Is my doctor in network or out of network for that particular plan? And all that is kind of driven through the funnel through that deep language model of Tabor, and Tabor is able to discern what the best option is for the individual.
If I could just add real quick that unlike the typical traditional method when an insurance agent will have to pick plans, compare plans, Connecture or Ascend, whichever tool anybody's using, those platforms can only help you finding the providers, finding the formulary, right? The right prescriptions, what have you. But it doesn't really, if you ask a question about, well, which plan offer naturopath, the platforms will not give you that. You will have to dig through all the PDF files to really educate yourself on which plans will cover like the most dental in Portland Metro, which plan, covers acupuncture or massage, or which plan cover my gym, right? So again, Tabor really is like one platform that have all the data that you need to equip yourself as an insurance agent.
Not being too technical, but those things, those other platforms you just mentioned are rules-based engines. So they only know what they've been told, and they're very kind of elementary in what they can answer. The beauty with a large language model is, and many people now are using chat just in their day-to-day lives, but the beauty with a large language model is it's almost like it's human. It will answer anything you ask it if it has the knowledge to be able to answer it. So it's the next generation in technology that's you're going to be able to, as Skypoint says, chat with your data, or chat with a large language model, chat with Tabor, and it's like talking to a human. It's that real.
Now that we've seen the problem and the potential of what it could do, we're going to chat with Diane and talk about some specific use cases, kind of going back to the beginning when we talked about the onboarding, the new agent onboarding. So here's the issue that we're facing, and Diane, you can add color to this, but we talked about the high attrition rates of these new agents. But with Tabor, you can get these agents trained and onboarded up to 10 times faster. And we'll talk about what that 10x means, but improve that retention. So Diane, the first question for you, tell me a little bit about the time frame to train an agent with an AI tool like Tabor compared to how you would do it with traditional methods without AI.
Yep. So traditional methods, it takes about 3 to 5 months. It's like a slow cooker for skills, right? AI like Tabor turns it into a microwave. Ding, your agent's training is done, and probably faster than you're microwaving your popcorn. So that's how powerful AI is to us as someone that has an agency, insurance agents and carriers. It just really, really 10x's everyone's production and just cuts down the time. And we all know time is money, right? So I'm again super excited that there is this tool that can help us save more agents and being able to get them going a lot faster than anything else.
So the average agent, how long does that typically take when you hire someone new? How long does it take them to get up to the speed where they're feeling comfortable to start enrolling?
3 to 5 months of training.
3 to 5 months.
Yes,
Okay.
because there's so much the data that a lot of it is again data, learning all the data that you must know as an insurance agent. And sales is about being confident on what you're talking about, right? You cannot be an insurance agent and just try to wing it. We don't do that at Health Plans in Oregon. We want to make sure we're fully equipped. We know our stuff because we're advising people's healthcare. This is a no joke. So having Tabor, that will just expedite that exponentially to have a tool like Tabor.
So how do you envision using Tabor to train your agents? Are you thinking of uploading all of your training materials, or what's your vision for leveraging Tabor to onboard?
I think a lot of the trainings that we do, being in this sales industry, there's sales training, obviously, right? This one, because of Tabor, has a lot of the data from Medicare website. So a lot of even like the minute details like financial assistance, like extra help and all that are all in Tabor. So it's all a matter of training agents how to use Tabor properly, right? Asking the right questions. So I would think it would probably cut it down to 5 to 10 days. It all depends on, just like anything else, right? On someone's eagerness, commitment, positive attitude, and really, being excited about how to get going in this industry. So I can confidently say we could train agents 5 to 10 days if they're committed to do it with Tabor.
I think that if you step back, you can view Tabor as your workhorse, right? And what you have to learn how to ride the workhorse, right? So you have to learn how to ask Tabor the right questions, and Tabor will transition from the workhorse to your own personal assistant. And I think that's the best way to think of AI. Is whether you're a physician, whether you're an attorney, no matter what the application is, Tabor becomes your own personal assistant in helping you to determine accurately and grounding the accuracy of that decision in finding that plan for that individual. And it gives the security to the individual, to the senior, and it gives the security to you, the agent, saying, okay, this is the best. This is the best that's out there. But I think it becomes your sidekick. It becomes the personal assistant alongside you, answering all your questions, just like having a human sitting next to you.
It's crazy how people are like so scared. Oh my God, AI is going to replace us. Well, not necessarily. I think that humans that doesn't use AI will be replaced with humans that uses AI.
I agree 100%.
Let's be clear, okay? I mean, I like this saying, and it should be trademarked by me: AI or die. Honestly, AI or die. You either adapt or you're gonna get left behind.
Can I use that?
Yeah, we should use it. Scott, you and I, let's trademark it: AI or die.
Put that on a t-shirt.
Sure.
There we go.
Love that. Okay, well, we talked about the training. We talked about increasing efficiency and onboarding. Let's talk about, you've answered a lot of these questions. Let's talk about some of the numbers, right? Income potential. How does this relate to onboarding and all of that attrition that we talked about earlier? Diane, before this call, you were talking about how this income potential is like the modern gold rush, right? And so there's a lot of potential income-wise to incentivize people for a good cause, right? Enrolling people in these plans and helping them. So tell me a little bit about some of the numbers that we're looking at here, and how is Tabor really going to incentivize people more and empower them to really make a better life for themselves?
So I think the biggest fear, in my opinion, of any agent is making the wrong advice or making the wrong decision for their clients. Okay. One thing is absolute truth with Tabor. All of the data, probably 99% of the data is in Tabor, as far as Medicare and all the plans, right? Because all the plan docs are in there. So having that, building confidence in agents' ability to help seniors picking the right plan will just dramatically change how much they can make in a year. So if you look about 12,000 people turning 65 a day, I don't quite understand why a lot of people are not getting into the Medicare space, to be honest with you, because there is such a massive need. There's more real estate agents out there than Medicare agents. It's crazy. And the amount of money, I remember when I first got in Medicare, I made $75,000 in my first year, 160 the following year, 275 the third year. And the fourth year was like 675 and then $1 million. I made $1 million in less than 4 years. that's how powerful Medicare is. With AI, with Tabor like AI, and with all the other AI platforms that now is changing the way we conduct our business, the way we can become more efficient. I tell my agents, you guys should be achieving what I've achieved in half, if not like way faster. That's how I feel.
Wow, that's great. Scott, anything you want to add here?
Like I said, it's going to unlock the potential for new agents coming into the marketplace. And I was talking to a FMO the other day, and he said, well, he goes, senior agents really, they know their products, they really don't need this, and maybe for a new agent it'd be valuable. And I asked him, I said, so is your senior agent selling in one county? Are they selling statewide? Are they selling regionally?
Yeah.
Are they what are they selling? If they're selling in a regional basis, on a state basis, there's no way they know every plan. It's just not, it's not comprehensible. Human brain cannot retain that much information. And I said, and besides that, I said, a new agent today, if they stick with it and we introduce them to Tabor, we get them trained on Tabor, and that becomes their personal assistant.
Mm-hmm.
A couple of years, they're going to become a senior agent. And it's a self-fulfilling prophecy. I mean, it's what everybody's going to use, whether you know it or not. Use AI or die. Whether you agree with it or not, everybody is going to be using AI. It is the way of the future. And if early adopters will succeed astronomically, the middle of the road will survive, and those that don't are going to die. So, yeah.
Well said. Well said. All right, moving on to the second use case. We talked about the income potential, how it's helping the agents. Now let's talk about how AI is streamlining the actual enrollment process.
Mm-hmm.
So the problem here, typically it's a slow manual enrollment process, right? But leveraging tools like Tabor, the agents can get these answers and solutions to help enroll the seniors much faster. So Diane, starting with you, what does a typical enrollment process look like without these AI tools? So a few months ago, actually, how was the enrollment process without AI tools? Can you kind of tell us what that looked like?
Well, traditional enrollment process could take an hour if you know your stuff, if you're a veteran agent, in most cases, right? If you're dealing with someone that is not complex, doesn't have a lot of prescriptions and medical conditions that you have to really shop the market. And as an independent insurance agent, we always pride ourselves, hey, we're not biased with any carrier. You are our boss. We work for you. We'll do what's best for you based on your situation. So it could take, 2 to 6 hours, sometimes a whole day. You need to get back to them the next day, right? Because you have to do your research. You have to, go to all the carriers' websites and see what could work well with your client. Versus if you have Tabor, instantaneously, if you don't know the answer to your client situation, you could use Tabor and immediately get the answers that you need right away, and you can make that enrollment right there and there, right? So a huge difference between doing your research and going all to different websites and compared to having a tool that will just give you the answer that you need based on people's situation.
And on the second question here, an agent in their first year, how many policies on average will the average agent enroll in their first year?
So a lot of it, a variety of factors, right? Agents' training, networking abilities, their commitment, their attitude and mindset. But I would say average about 30 to 50 apps a year for new agents. That's average, okay? Obviously, you have Michael Jordans, right? And then you have average folks out there. And a lot of it is based on, again, being able to adapt and really learn as much data, insurance information as fast as you can. So that way you can go out there and help people with their insurance needs.
So with tools like Tabor, are you able to shift your forecasts and expectations to say, hey, with this new tool, you can go from 30 to 50 to 100, 200 a year?
Yes, I would say 100, because again, a lot of the lag time is just having agents learn a ton of plans, right? So if you're doing 2 to 3 states, then even more plans that you have to really, learn. If you're doing one state, then it's faster. So I could confidently say 100 to 150 to 200 is achievable with a tool like Tabor, because again, it cuts down that learning curve that a lot of agents, right? I usually tell my agents, it gets so hard, okay, but hang tight, you're kind of like this, and you just need to get over that hump of learning curve, and you're off to the races.
Scott, a question for you. What is Tabor doing on the accuracy side to ensure that Tabor's getting it right for the agents, and they're not having to depend on their own knowledge?
Mhm.
Yeah, well, to that point we talked about just a second ago, is that grounded accuracy, the fact that you have confidence for the new agents and for the senior agents, you have confidence that what you're telling the senior is correct.
Mhm.
And the confidence in the senior to say that you're able to say, look, we use an AI tool that has ingested, digested, and analyzed all the variable plans in the marketplace, and this is the best plan for you. Just the ability to have that kind of credibility and that kind of confidence in dealing with a senior is going to go miles into being able to write the policy for that senior. The other thing I'd say is, to Diane's point earlier, is, I talk to a lot of FMOs out there in the world, and I asked one the other night. I said, how many of your, how many of your agents actually write policies? And he said, it's an interesting thing. He goes, these agents, they every year they have to get renewed by CMS. They have to get accredited with each health plan, and it takes time and it costs money to do all of those things. And he said they do all that. They spend the time, they invest the time, they spend the money, and only about 30 of them or 30% of them write policies. He goes, it's nuts. He goes, I can't figure it out. I said, well, we figured it out. We know that it's just too hard,
Yes.
and they're not confident. And I
Yes.
think Tabor's going to go a long way to
Yes.
inverting that and make 70% of those agents be able to write policies and feel confident and accurate in doing so.
Mhm.
Diane, talking about some of the answers that Tabor is providing, can you provide some examples of
Yeah.
the questions that your agents are able to ask and the answers that Tabor can provide?
Yeah, it's as simple as, hey, what mail order does Providence or United Healthcare uses? Or what the most common one is the food card. What can I buy with my food card? Hey, Diane, can I buy a steak, sirloin, New York, or whatnot? I'm like, doesn't matter. Steak is steak. Go buy it. It's as simple as, again, any questions that you might have. But these are the most common question. Well, it's funny because one of my agents says, Diane, can I buy this AI and send it to my clients so they can ask the question to this AI, and the AI will just give them the answer? Because then I can be more focused on helping newer clients. So yeah, it's like who's got the most dental coverage in Portland Metro, or which plan will cover acupuncture. Like any questions really, Tabor is able to answer. So anything that you need, that your clients might need or ask you, it's there, because again, it has all the data that you need as far as Medicare is concerned.
Scott, I think the future of Tabor is being able to ask really complex scenario-based questions, right? Do you have an example of some scenarios that Tabor is working on providing answers to that are a little bit more complex than just here's what this plan provides. Do you have any examples?
Sure. I mean, look at a senior that's polychronic, right? So we've got COPD and CHF. They're on a multitude of medications for each one of those.
Mhm.
They have a doctor that's, I'll go up to your neck of the woods. That's a Providence doctor. Is my doctor included? Is my doctor in network?
Mhm.
Or when I go on to Medicare, am I going to have to change my doctor, change my hospital? All of those questions. I mean, it gets really, really common. If you're an agent, and it's not uncommon for a senior to be on 15 different medications, for you
Yeah.
to have to go and research each plan, whether the medication's included or not, what tier it is, how much of it's included, what is the copay, is hugely time consuming. What Tabor does is it's able to look at all that stuff in its totality and then drive it back down to, okay, we're looking at them all. Here is the one that best fits. I mean, it may not include everything, but
Mhm.
it's going to include more than any of the others, or as much as some of the others. But it's going to drill down that funnel, make it a lot easier to make that determination. We're able to ease up the agent's lift. He's going to have a lot more free time, and that free time is going to transpose into hopefully more lead generation so they can write more policies, or they can go fishing. I mean, whatever they want to do, but it's going to make life a lot easier on that agent. And there's nothing else like it. I'm telling you, until you start using it, it is revolutionary. It is disruptive in
Mhm.
in the industry.
All right, moving on to the final use case here, a little bit more future forward looking, talking about the proactive client engagement, going beyond the enrollment process, right? That client service mentality. So the problem potentially could be the plan coverage changes, right? I know I get letters every once in a while from my provider, hey, your doctor's out of network, or your plan, we've dropped this carrier, or so on and so forth. So with Tabor, potentially could provide that proactive client engagement to reach out to a client and say, hey, this plan is changing. I've got a better plan for you.
Yeah.
So, Diane, can you talk a little bit about that scenario in the future of how these plan changes impact the seniors as well as your agents who have to manage those relationships?
Absolutely. It's again that constant change every year it changes, right? And it does affect our seniors' healthcare, including medications, preventative care, or out-of-pocket expense, impacting their budget, and maybe change of networks. And it happens every single year. Like it's crazy how contracts, like just this month alone, we already seeing a couple of big providers that are not accepting certain plans now. So it's constant change in this industry, and super important to have a tool that you can trust, that is able to give you the right information, so that way you can best help your clients with their healthcare, um, especially with regulations, and all of the changes that sometimes CMS will come up with.
And Scott, for you, how do you see Tabor helping with the client retention and providing that proactive service approach? Maybe it's connecting it to a CRM. How do you see this proactive engagement in the future with Tabor?
So, and Diane, you can attest to this. I mean, new sales are half of the equation. The other half of the equation, or three-quarters of the equation, is your book of business, right?
Mhm.
By the time you become a seasoned agent with a large book of business, you're making more money off your renewals than
Yes.
off of your new policies.
Yep.
So, how do you keep those seniors in your book of business? That being said, seniors are really loyal.
Yes.
Um, and so, but they have to, it's like they're all from Missouri, right? It's a show me state. And they all have to be proved, they all have to be shown that you're as loyal as they are.
Yes.
So I think what Tabor's able to do is to, on the renewal side, and talking to another FMO, he goes, "You guys can handle renewals?" Absolutely. He goes, "Holy crap." Um, so it's able to go in, survey all the plans, their existing plan, all the new plans for the upcoming year, and determine whether it is the best plan still, or if there's a better plan out there. That's one use case. The other use case is if there's a changing condition. Let's say that the senior is going to be moving into senior housing, my former world. That opens a special enrollment period, which means that the senior is able to change plans. And if you're not on top of that, aiding that senior, healthcare is personal. If you're not on top of it, aiding that senior, somebody else is going to be jumping in, doing it for you, and they're going to take them from you. So I think the beauty of Tabor is it opens up the front door for enrollments. It's going to make you much more effective enrolling new policies and new seniors, new clients, and it's going to shut your back door. So it's going to keep that book of business. It's going to keep those seniors loyal to you, and you loyal to them, because they know that you have their back, and you're constantly communicating, because Tabor's communicating with you. You can communicate with them about what's going on and how it's going to affect them.
Yeah, client retention is such a huge part. It's a cornerstone of our work, right? So AI, like Tabor, can help our agents stay current on the latest products, regulations, industry trends, enhancing our expertise and ability to serve and support our clients all year round, helping them utilizing their benefits and being able to support them all year round is a huge thing. Our agency, we're so big on that, to take care of our clients, to create biggest fans, and to have a tool like Tabor to equip us to be able to best serve them is going to be invaluable.
Yeah, it looks like you kind of hit on all of these questions here in one way or another, providing some of that context there. But maybe the last question, how about on the support for confidence on the sales side? I'm sure there's probably a sales component to your agency. So can you talk a little bit about how AI is impactful there?
Absolutely. Like if you think about, when you first started going to the gym, you probably hired a trainer, right? So I see Tabor as more of my sidekick, like kind of like what Scott's saying, as an assistant. It's a tool that is on my hands, on my phone, on my laptop, online, that if I have to check something, if my agents has questions, I have it readily available. I mean, who has time nowadays to open 10 different web browser and to research each of the plans, right? So you kind of have this support coach, assistant, that you can utilize, that you're able to do your job better. And in fact, you can beat the competition because of how much knowledge you have. I mean, the AI has, which you have because you're using the tool, right? It's like the biggest cheat code out there. Tabor AI is.
That's pretty powerful. The biggest cheat code. That's another thing to put on a t-shirt.
Trademark too, Scott. You're gonna get going on it. We have a ton of lawyers.
Boy, I gotta, Drew, I hope you wrote all those down, because
we're recording.
We had a lot of t-shirts to make.
Yes, a lot.
That's right. Well, thank you for the insights into some of those fantastic use cases. As we wrap up here, we'll have a little bit of time for some Q&A, but some of the key takeaways from this discussion we wanted to hit on. Again, AI is not about replacing people, as Diane said earlier. It's the people who leverage AI effectively that are going to be the winners, right? AI is all about productivity. It's about enhancing the human, putting the human back at the center. It's a win-win scenario, right? Where Tabor and AI are providing better experiences for everyone. The agents enrolling, as well as the seniors getting the best plan and the best service. That's how AI is going to amplify us as humans. And I think it's also a vital solution in the demand gaps, right? The massive spike in enrollment that we're going to see by the year 2030, not a lot of new agents are starting. There's a gap. So AI is the solution to help fill that gap. And every industry has a different type of gap, and Medicare has its own, but AI is definitely playing a vital role in that future.
Mhm.
And then this kind of harkens back to the vision of Tabor, but keeping the senior at the center, right? Where, yes, there's an income potential, but it's all about taking care of our seniors tomorrow, making sure that they're getting the best care and getting the best plan, using our government funds appropriately to make sure that we're optimizing everything. And we talked about some opportunities to 10x productivity, efficiency, even potentially income. That's what AI is all about, right? And then, Scott, these were your words, kind of the evolution of from moving people from just an agent to a trusted advisor, right? They're not just an order taker. They are now empowered to provide an experience and be that trusted advisor, not just for enrollment, but beyond the sale, right? The re-enrollment, making sure that they're taken care of. Anything you two want to add to this slide before we jump to Q&A? Diane, any closing thoughts?
Well, I think that if we look back, I really think we live in a very exciting times, the best ever. I say that because if you look back in 1800s when telephone was invented by Graham Bell, and then fast forward 1940s to 60s, computers were invented, and then you have internet in the 90s. You've got mail. Oh my gosh, like the best message ever. You've got mail. Oh, I got mail. So exciting. And then now the development of AI, how it's changing our world, how it's solving so much current problems and so much advancement to the modern world. And I truly believe that adapting to AI and to a lot of the AI platforms or apps could dramatically make us more productive, grow bigger, faster, and make the most impact in the world. If we're utilizing it the right way, we're using it the proper way, we can change the world, serve our seniors better, the best way possible, because they do deserve it. They deserve the best plan possible for them. And more importantly, for us to live a fulfilling life, because now we have the life balance. We have a tool that can make us so productive. So we have time to go do some exercise for 10, 15 minutes a day, or, go enjoy our walk, or, have time to actually eat our lunch for at least an hour if we want to. So AI or die, everybody. Adapt to it, because if you do, your life will be dramatically changed.
Well, Scott, I don't know how you top that, but
I don't think I can top that. Yeah. No, I think that just to pile on to what Diane was saying is AI is, it's only been, if you put it in perspective, it's been here a year, right? It was last January that Microsoft kind of launched ChatGPT. So in a year, look how relevant it has become into the fabric of our society. You take it out next year, 3 years, 5 years, 10 years, it is going to grow logarithmically within our society. So, like you said, you got to get on early, and be able to learn it and use it to your advantage. And it's there to be used. And quite honestly, how much does it cost you to hire your own personal assistant? And that's exactly what this is. It's your assistant that's doing all your research, all of your legwork, all of your heavy lifting. It's doing it all for you. You're being the advisor, the concierge advisor to the senior, and creating that relationship. You become just the face man. All the work's being done by Tabor. So that's my 2 cents.
Question here, are there advantages or disadvantages of giving the client access to Tabor? They could look up new providers, they could check what the copay is for a certain medical procedure, but it seems it could get out of hand where the agent is no longer needed to the client. Great question.
Yeah, that's a possibility. But it's not likely. And the reason it's not likely is healthcare is personal. And seniors want a point of contact. They want to be able to talk to somebody. and they want that relationship. So I think that, yeah, they can look it up, but they're going to have to come to you. They're going to want to come to you to write the policy and to have you attest that, yes, that is correct. This is the best policy. They don't want to live in a vacuum. They don't want to live just on the internet, so to speak. So I think it's important to keep in mind what's important to the senior.
I think it could go both ways. I'm more of it, once the AI is able to really more advance, because right now, I would say the AI Tabor is a baby or maybe a teenager. Once it becomes a senior, then I would argue it's able to help with the enrollment process as well. But I think for complex stuff, it's good to use an agent. But I'm more on 50-50 on this. I think the AI has to be more mature to be able to just expose it to the public. Again, the goal is to have Tabor as the assistant, as kind of like the brain that knows it all as a tool. And then the agent of that, because of that emotional connection, human connection that is vitally needed by seniors, I think is more useful.
I want to thank both Diane and Scott for their time. Thank you for sharing your use cases, your insights, and how this is going to change Medicare as we know it. So please connect with Diane. She's got health plans in Oregon.com is the website. You can connect with Diane on LinkedIn. Follow up with Scott. Check out tabor.ai. They've got lots of use cases, examples there if you want to see some more examples of what we talked about. And then reach out to Scott if you'd like to schedule a personalized demo or learn more about Tabor as this technology advances. And then stay in touch with Skypoint. We provide a lot of data and AI resources. If you're just wanting to learn more about this emerging technology that's constantly shifting underneath our feet every single day, we try and educate people as much as possible about these emerging technologies. We provide free workshops with the Microsoft stack. So if you're interested in that, head over to skypoint.ai and go over to our events. We have free workshops on a monthly basis. Diane and Scott, thank you again so much for joining us today on this webinar. And hopefully we'll have you back on again to talk more about your experiences with AI.
Okay, our pleasure.
My pleasure.